Our topic today is cancer warning signs, specifically the common indicators to look out for. The first thing to know is that cancer often has no specific signs. While some types of cancer display symptoms early, there are others that show almost no symptoms at all. And often by the time you discover them, it is already too late. The first sign is a typical one you can completely monitor yourself at home. It involves touching your collarbone area, specifically the supraclavicular region, the hollow above the collarbone. If you feel along this area from the inside out or outside in and detect a developing node, it is often a cancerous node. Typically, nodes above the collarbone are indications of cancer in the mediastinum, the chest area between the lungs, or the abdominal cavity spreading upwards. Specifically, lung cancer is very common here. Patients who find nodes in this supraclavicular fossa face a much higher risk of malignancy. Conversely, if a node appears lower down around the neck or chin, the likelihood of it being benign is higher. Nodes in the chin area are mostly inflammatory nodes. The second sign for women is the presence of a lump in the breast tissue. When you touch the breast area, you may feel a mass, particularly in the upper outer quadrant, the top outer of the breast. If an abnormal lump appears in this location, there is a possibility that it is cancer. At this point, we must be vigilant and go for a biopsy and histopathology to confirm whether it is cancer or not. After that, we will determine a treatment plan. The third sign is a persistent cough with no clear cause. If you have a lingering cough and don't know why, usually, in benign cases, you might be experiencing asthma or gastroesophageal reflux, GERD. But if the cough persists and has been treated for a period of time without improvement, you should go to the hospital for an examination. This is because cases of lung cancer also present with these symptoms. The fourth sign is a prolonged fever, also without a clear cause, meaning the patient has a persistent low-grade fever. In cancer patients, a state of slightly elevated body temperature occurs, resembling a state of hypermetabolism, increased metabolism, so the likelihood is that it is due to cancer. Mostly, there may be a tumor somewhere that you haven't detected. Note that cases of pulmonary tuberculosis also experience this condition of persistent unexplained fever, often in the afternoon. The fifth sign is unexplained weight loss. To be more specific, these are abnormal developments where the cause cannot be identified. In such cases, you might consider cancer. For example, losing 1 kilogram in a month is very normal, but if you lose 2, 4, or 5 kilos in a month without an explainable reason, you need to see a doctor. You need to pay close attention to this condition of unexplained weight loss because our bodies don't just naturally lose weight unless you are dieting. The sixth sign for women regarding gynecological cancer could be the appearance of bleeding after intercourse or abnormal bleeding outside of the menstrual cycle. These are abnormal signs that warn of the possibility of gynecological cancer. The seventh sign is prolonged bouts of fatigue. Cancer patients often experience persistent tiredness or the appearance of changes on the skin's surface. When you think about the possibility of contracting this disease, or wonder if there is a way to prevent it, the first method of prevention is that you must maintain a healthy lifestyle and regimen. Of course, cancer involves genetic factors, and these hereditary elements are difficult to improve or change. However, issues related to diet and daily habits are clearly things you can completely improve.